There's no easy generic way to describe how to safely lift or move a patient. Each patient and each situation is unique. For example, during your busy day you may have to move a patient from a bed to a wheelchair, or from a wheelchair to a bathtub. Obviously, each task is different, and each one has a specific way in which it can be done safely and correctly. Let's take a look at how to lift and move patients in and out of wheelchairs. When moving a patient from a bed to a wheelchair, you should explain the move to the patient before you begin. Because the patient will need to assist you during the move, it's a good idea to let them know how they will need to help you. If they are not capable of helping, you may need to have someone else help you with the move. If you must move the patient by yourself, a transfer belt is recommended. A transfer belt fits snugly around the patient's waist to provide you with a firm handhold. Transfer belts act like handles on a patient's body. You can safely lift or lower a patient without having them slip out of your grasp. Before you begin the move, make sure that the height of the bed has been adjusted for easier access. Position the wheelchair near the head of the bed and lock it in position. The wheelchair should be placed either at the foot or the head of the bed, whichever will allow the patient to move toward the chair with their strongest leg first. Spread your feet apart, bend your knees, and reach down to the patient. Place your arm under the patient's neck and support their shoulder blade with your hand. Place your other hand under the patient's knees and swing their legs over the edge of the bed, helping them sit up. If the patient has difficulty scooting, help them shift the weight of their trunk from side to side as you gently pull their hips to the edge by grasping above and behind the knees. Have the patient scoot out to the edge of the bed. Bend your knees and place your feet as far apart as is comfortable. Put your arms around the patient's body, close to the pelvis, and clasp your hands behind their back. If the patient is wearing a transfer belt, hold on to the belt at the patient's sides or back. As the patient pushes down with their arms on the bed, lean back, shift your weight, and lift. If the patient is weak or has trouble standing up, brace your knees against theirs to keep their knees from buckling. Now have the patient slowly pivot toward the chair. As you continue to hold them, keep your knees bent. While your helper steadies the chair, have the patient reach for the arms of the chair. Bend your knees further and lower the patient into the chair. Your helper can help you position the patient into the chair so the patient is sitting with weight equally distributed over both hips, with hips at the back of the chair. To move a patient from a wheelchair to a treatment table, work carefully and slowly. Generally, a treatment table is higher than a wheelchair, and the patient must help to push themselves up onto the higher surface. Make sure you give the patient time to rest and gather their strength before attempting the move. Ask the patient to let you know if they become tired and need to rest. First, position the wheelchair as close to the treatment table as possible so the patient can move to their strong side and lock the chair. Spread your feet, bend your knees, and grasp the transfer belt. Have the patient push the armrests as you help them stand. Slowly have the patient pivot and step backward onto the stool or sliding stair step with a strong leg first. Support the patient by holding them as they push up onto the table. Sometimes, despite all of your best efforts, a patient will begin to fall. When that happens, your first thought will be to try to catch them. But trying to catch someone is difficult and dangerous because once the falling momentum starts, it's almost impossible to stop. Your best bet is to go down with the fall and help the patient to the floor with as little impact as possible. If you happen to be next to the wall, you should gently push the patient against the wall to slow the fall. Move in close enough to hug the patient. Remember to protect the patient's head as both of you move toward the floor. Then call for help. A patient who has fallen may feel dizzy or faint. Be sure to calm them as you check to see whether or not they have been injured. If there are injuries, you should tend to those first before trying to move the patient. If the patient is unharmed, You can begin the move back to a bed or gurney. Be sure to get help. 4 or more people may be needed to help you. The best way to move a fallen patient is with a blanket or a heavy draw sheet. Carefully roll the patient onto his or her side as you place the blanket underneath them. Roll the patient onto the blanket and cross the patient's arms over their chest. With 2 or more people on each side of the blanket, have each person kneel down on one knee and firmly grasp the blanket. On the count of 3, everyone should lift the patient and stand up. Move the patient to a bed or gurney. Now that we've shown you how to move and lift patients safely, we'll remind you of the importance of a healthy back. A healthy, strong back is one that's less likely to be injured or aggravated. Just a few minutes of back exercises each day can keep your back healthy and strong. Your doctor can tell you the exercises that are best for you. If your back does ache, there are a few things you can do to reduce the pain. Resting is a good idea. Lie on the floor with your spine comfortably balanced. An ice pack can reduce the pain and swelling. Apply the ice for 30 minutes at a time, 2 or 3 times a day. Aspirin and other anti-inflammatory pain reducers may be used. Finally, gentle stretching can prevent stiffness as well as increase your range of motion. Do a few slow stretches every hour or so. No matter how strong you are or how big you are, moving patients can be difficult or dangerous. When you're not sure if you can move a patient safely, ask for help. Don't forget that teamwork can lighten your load. Both co-workers and patients can help you, and transfer belts can make the job even easier. Remember, you don't have to be strong to lift or move a patient safely, just smart enough. Thank you.